Well, more than 100 infants died in Idaho in 2020, and coroners say investigating those deaths thoroughly can help save lives. I took a closer look at why these cases require such intensive investigations and the changes coroners say are needed.
Being able to give him answers and help him is important.
It's a number that's hard to hear.
They're not common, but they're not uncommon.
In 2020, 109 infants died in Idaho. That's according to the World Population Review's latest data.
We routinely will see infant deaths coming through our office every other week or so.
And those deaths are something Ada County Chief Deputy Coroner Brett Harding says need to continue to be thoroughly investigated.
Infant death investigations are the most difficult investigation there is.
He says one of the reasons these investigations are difficult is because the investigation usually starts at home and ends in the hospital. That creates two different scenes for coroners to investigate. With other coroner investigations, Harding says the home isn't tested as thoroughly as it is with infant deaths.
Sometimes it is difficult to get the information that our pathologists need to come to a correct conclusion or a definitive conclusion.
Harding says infants also require more extreme testing, especially if the cause of death is unknown.
And then the testing that goes in with infant deaths is very intensive, because we do blood tests, we do cultures, we do genetic testing to bring every possibility to light that could have caused that child's death.
And what's unique, Harding says, is that sometimes an infant death can prevent other deaths from happening in the same home, making the investigation even more important.
Because if you don't identify risk factors for that child's death, then, and the parents aren't educated on that, if they have another child, that same child could be put in that unsafe sleep environment and they too could die.
But in Idaho, coroners don't need any type of qualification to be in office. That's something Harding says is highly problematic.
Because not only does the coroner have to determine cause and manner of death, but they also have a large public health component to them, to which can affect the living as well as the dead.
That's why he's hosting trainings in Ada County, Idaho Falls, and Coeur d'Alene this year to help educate coroners on specifically how to investigate an infant death.
Also, we are going to explain to coroners, to law enforcement, to firefighters, why these also need to be done and why their information can be critical in determining why a child died. So this is going to be an education for the professionals that respond to infant deaths, and then through educating them, when they have an infant death, they'll be able to educate the public, the parents, or caregivers for infants that had died.
Harding says many families don't realize how extensive these cases can be unless they're walked through the process after a tragedy.
If they suffer a loss like that, they need to know that their coroner has certain things that they need to do to try to identify why that child died.
And at the end of the day, while nothing can bring an infant back, Harding says what they can do is provide answers so preventable tragedy doesn't happen again.
Because I saw what we did for families and how the answers that we gave them affected their lives and helped them in the worst scenario that they were going through. It's a tragic moment, but we were able to give them answers. And